I'm Mohammad Nurullahi. I continue the journals part. About here, we try to explain three journals, but one of them is the main journal. In this part, we try to explain the related of tooth erosion to GERD. What is the GERD? GERD is a digestive disorder that affects the lower esophageal sphincter, LES. It's the ring of muscle between the esophagus and the stomach. Many people suffer from heart burn or acid indigestion caused by GERD. We can see this symptom: persistent heartburn, stomach acid rising, sore taste in the mouth, burning in the throat, and pain or burning in the chest. LES is a lower esophageal sphincter located at the lower end of the esophagus, allow pepsin and stomach content to backflow into the esophagus. That is make pain and burning in the area located close to the heart. In contrast, symptoms higher up in the esophagus that are linked to the upper esophagus sphincter, UES, range from allergy and asthma type symptoms, chronic cough, and post-nasal drip. There are different risk factors for the GERD. Generally, all factors which include conditions that cause LES incompetence make or should be risk factor for the GERD, like consuming alcohol, caffeine, many different medication, or conditions that cause increased intra-abdominal pressure, like obesity, pregnancy, straining, and bending. Also, the other condition like increasing gastric volume, like heavy meals and intestinal obstruction, is included. First journal discuss about the rule of diet. In this journal, they divided the people based on the diet to different groups. Based on the table, as a result, we saw that the eating 1 to 2 meals a day, eating fatty product, eating a spicy product, and also eating one big meal in the evening, and also drinking fruit juice, it has a very main cause for the GERD. If you check, we can see that the value of P is less than 0.1. That means is really significant factor there. And we can see that based on the what habit of our patient, the patient consuming this kind of food. Second journal discuss about the relationship between tooth erosion and GERD. In the recent systematic review found a median prevalence of 24% for the tooth erosion in a patient with the GERD, and a median prevalence of 32.5% for GERD in adult patient who had tooth erosion. Interaction between endogenous acid and saliva and tooth erosion. Saliva play a major protective role in the oral cavity, repair of hard tooth tissue by remineralization, buffering action of saliva, and saliva antibacterial and antifungal properties. In this figure, we can see that because of the charge of endogenous acid is more negative, so the enamel attract in the endogenous acid that caused by GERD more saliva. So that makes change the physiologic balance between remineralization and demineralization and converts this balance to more demineralization. That makes dish-out lesion on the cervical part of the tooth. Based on medical history of our patient used amlodipine. What is the amlodipine? Amlodipine is used to treat chest pain and other conditions caused by coronary artery disease. Also, it's used to treat high blood pressure, hypertension. This is the condition that our patient has. This drug, as antihypertensive drug, act as a calcium channel blocker, was shown to reduce LES pressure as well as the amplitude and duration of esophageal contraction. It also increases esophageal acid exposure time. So we can see what is the effect of this drug.